Hi, good morning, good night, or good whatever time you're watching this video. This is another week in my life as an observer in Jamaica. So I really hope that this helps. I shared a lot of information in the video and a lot of topics and good stuff. I wanted to start this video off with something helpful, and that would be some high yield topics, some must knows for obstetrics rotation ONG. So let's get right into it. There are some high yield topics that you should know when you're on the OBS rotation. Know gestational age and termination. Know about postpartum hemorrhage, antepartum hemorrhage, premature rupture of membranes as PROM. About anemia in pregnancy, gestation, like hypertension, where that's like hypertension is a big one. So you'd have gestational hypertension under it, chronic hypertension with superimposed preeclampsia and preeclampsia, right? Yeah. And you should also know about preterm labor. That's a big one. Preterm labor, malpresentation and breech and delivery of breech. And you should also know cervical incompetence and Leopold's maneuver. So I'll just put it on the screen and you can screenshot it and write it down. So those are like must knows. Morning, it's an OT day. What is it, gynae? Oh, gynae and general surgery. So it's 8 o'clock now. We have a case. I'm not really sure what it is. There's like a roster where you can see what's going to happen every day. So I'm going to look at that and change. And yeah, that's it. I'm hungry though. I didn't eat breakfast. And on OT days, I don't like to not eat breakfast because it's like a whole day thing. So I think I'm gonna wait till it and then go back downstairs and buy bun and cheese because the line was long this morning. I can't bother something with. I am so happy that my auntie got these for me because what would I do? Hey, so I stepped out because I won't even lie. Sometimes when I'm watching the case, the progression, I get so dizzy. I feel like I'm gonna drop down. So for us, we have like tutorials or like presentations every week, almost every day, like different groups, because you have like the 4th years here, you have the 5th years, the seniors and the juniors. So like this would be the schedule. I don't know if you can see. I should probably since it's the 12th, we're supposed to have a tutorial on hydramnios, like oligo and polyhydramnios this morning, and then sometimes we have it in the mornings and in the evenings or in the nights. So there's a lot of topics, and as you can see, it's like almost daily. We have the 4, 5, 6, 7, 10, 11, 12, 13, 14. Yeah, so not only are we getting like the practical, we're getting a lot of classes. So there's a lot of theory and practical at the same time. So that's one thing I like about being here, to be honest.
I hear you live. No? No, not very.
So you cannot do it because I'm not like, do you notice it? It's almost like it's like that. So imagine your hands like that. This is the left, that is the right. Left, right.
Oh.
So tell you, this is your left, that is the right. So you're gonna hold your hand like this. Like this is too big for me. Too small for me. And you pull it down over the cuff. So the cuff, everything should be up here, the gown, and it's over the cuff. And then the other hand, and I hold it like that, and you put your hand in. This sometimes the glove isn't positioned properly. Like, I'm pack it fast and they don't. So for example, I shouldn't have to do that a while ago.
Okay, so now we're at day 2, and day 2 was really short. We ended up going to a class, obstetric examination and history taking.
And then the other week you can do gynae, then 2-week mat, 1 clinic, and we just keep doing it like that. 2 mat, 1 clinic and theater, 2 gynae, then you switch again.
First, you hold our hand. You say our hand is warm as opposed to cold and clammy. So it's warm to touch. And you squeeze the nail. So she has a normal capillary refill. This is a normal capillary refill. Okay.
So when you're doing a physical examination, there's a certain method or a process that you should go through. First, you should introduce yourself. Heck, good morning, I'm a fifth year med student, and I'll be here to do your physical examination if that's okay with you. Ask for consent, and when you position the patient in a supine, hands to the side, supine by the side, your legs uncrossed, and then you expose them. For privacy reasons, you don't have to expose them from nipple to toes. You can do from abdomen to mid-thigh for privacy reasons. And then you start your examination. You stand at the foot of the bed on the right side, go to your abdomen, and you can, I think in the video, Doc was talking about capillary refill and the temperature if she's warm to touch on both sides. Her ask for vitals, check the BP, the temperature, ask for urine dipstick, her weight gain over the last few weeks, because every week pregnant people are supposed to gain like 1 kg. Ask if she's on Magself, what kind of drug she's on, face and neck, if her mucous membranes are pink and moist, a fibra, you check thyroid, this is the stuff. And then you can move down to the abdomen, and when you're at the abdomen, that's when you start at this symphysiofundal height, and then you can do the Leopold's maneuvers. And yeah, that's just a speed through of what we learned and what I printed. We got this from the doctor. He gave us like instructions and notes and case studies to help us with it. So yeah, that's what I have here, and I wrote up a study timetable. I usually do this in China, but I kind of fell off because I stopped caring for some time, and so I'm just trying to pick up back the pace. You have a 35-year-old multigravida seen in the outpatient clinic for her first prenatal visit. She's at 12 weeks gestation with a BP of 155/95. She have chronic hypertension. The diagnosis 5 years ago, but she treated with the oral nifedipine. A spot urine dipstick of protein 2+, and a recent urine collection show 1.2 gram of protein and a creatinine clearance of 85.
The feet having
Chronic hypertension
and 14 years at this time, she probably have chronic hypertension
with
renal disease. She definitely don't have preeclampsia, because preeclampsia kicks in after 20 weeks.
Okay.
So the reason why persons have preeclampsia is because the placenta, remember they don't have a placenta at 12 weeks, they have a chorion. So the placenta now start to embed in the myelin and the muscle.
Creating twins. One of the most common mechanisms by which twins are formed is this dizygotic situation. The lady ovulates, 2 eggs are released, and once there are 2 eggs released, there is a gazillion sperm. So it's not difficult for them to be both fertilized, dizygotic twinning. This business of 1 egg splitting is a bit more uncommon. Now, what is the incidence of twins? So what was the incidence of?
I'm improving with like taking blood. At first I was so nervous. I'm getting better at it. Like I'm not missing the veins anymore, and so I feel good about that. Remember last time, like when I was showing what was in my bag when I had like a tea bag, and I know some people will be like, why does she have tea bags in her bag? But trust me, on Monday it saved my life. Okay, like my belly was just not having it. It was giving me a really hard time, and that tea bag saved me. The only thing I wish we did have like sugar or something, but yeah, it's good to work with things like that. It's not enough to ask nobody for nothing, especially like when them have like a lunchroom and see them with them teas. And sometimes depending on which word you're on, I didn't experience this at Mandeville, but depending on which word you're on, they're kind of stingy with the stuff. So just better you just walk with your own something then. Just better, so you don't have to ask around for things, because they're going to want you to pay, because they're like, oh, you're not using it, you're going to need to pay for it. And just walk with the things that you think you might need for like a rainy day, quite literally. Yeah. Or if you know your belly very hurt, you walk with your pills, your pain pill, them walk with your tea, walk with snack, juice, water, anything where you're gonna need. Tissue, wipes, soap, lotion, everything. Good morning. So it's Saturday now. Didn't really talk much yesterday, but when I went there in the morning on the ward, I was doing physical exam on the patient, and I could not find the lie of the baby. And I'm there like palpating, and I'm there doing the maneuvers, and I was like, oh my god, I don't know where the baby is. Like I don't. I found the baby's back, but I'm like, okay, this is the back. Where's the hand? Where's the head? Shit, oh shit. And then she's looking at me, and I'm just there looking at her like. I feel bad because I'm supposed to know how to do it, but I know that I shouldn't be so hard on myself, but I couldn't, and I kept trying, and I just got overwhelmed. And she was like, it's fine, like you're a med student, you're going to get it eventually, don't be so hard on yourself. And she said she likes me a lot, and I'm really sweet, and I should keep at it. And I'm just like crying because I felt touched. Like it felt like a mother's love, like literally. I mean, she is pregnant, but I felt so seen. And then she gets up and she hugged me. And she's there patting my back, and I'm there like and you know, some people might find that really weird, but I thought that was really sweet. And I know not everyone is like that, and I'm so grateful I'm here. I really feel like it was meant to be good. And then the doctors, they're like, okay, we're gonna show you what to do. Like, it's fine, you know, we'll teach you. And they're just so, like, the whole day my heart was just full, like just full. And I was just so grateful for everything. Today I'll be going over to the gynae ward. Never really been there before, so I don't really know what to expect. There's this book that I used to study actually 2 books. I'll just make a separate video on them, but it's called 10 Teachers, and I use a USMLE book. I read the obstetrics part, but I haven't read the gynae parts. Since I don't really know what goes on gynae, to be honest, I was just looking through the dockets and trying to figure out the most common topics that fall, like, that present on gynae ward. Like, what are the things that people usually have, or like what's really common on gynae, and trying to look it up and read about it, and like look at the plan and see why they would write this kind of plan for what. So that's what I was doing. Still gonna go back and try and read some more. There's a lot you can learn from reading a docket. At first, a nurse told me that, like, just doing like a summer program in August. She's like, read the docket, and I'm like, ugh. But then when you actually read the docket, you learn a lot. So that's what I'm doing. I'm going to write down the little, like, diagnosis that people come in with, and see if I can study them more when I go home. Alright, so what did I do today? What did I do? There's something that I really need to learn, and that's the order of draw. What I understand from it is that blood must be collected in a specific order to prevent contamination, right? So they have these little tubes. I don't have them right now, but I'm sure I'll just like insert a video or something. They have these tubes, and some of the tubes have little like solutions in the bottom of them, or like probably a powder or liquid, and they're for different things. Some of them might prevent clotting, some of them are for other reasons. So to prevent cross-contamination, they like to follow a specific order. So they fill this one first, and then after you do this one, if you need to fill multiple tubes in just one draw, you follow that order of draw. But if you only just need to fill just one specific tube, then that wouldn't apply. So yeah, like yesterday I had to do a CBC and I had to do a HbA1c, so I needed a purple top, 2 purple tops. But if I needed to do like for folate, I'd probably need like a red top and a purple top, whereas I'd fill the red top first because I think I'll insert like the order. Red would be before violet, so I'd fill the red one first and then the violet one after. Oh, there are some tubes that you can shake and some that you can't. For example, the red one, after I fill that one with the syringe, I can't just can't mix it. But for a violet tube, I can do that. I should do that actually. We're trying to learn how to suture, like practice. I found this old, like, what's this called? I don't even know. Foam something. And we got some old instruments and we're just practicing. But we just had a session with a doctor again. I did one this morning with the seniors, that's the 5th years, and I did one this evening with the 4th years. I already did 4 weeks with the 4th years already, but a new set of 4th years are here, so I want to join the classes along with the 5th year class, 5th year tutorials along with the 4th year tutorials, so that I can refresh my memory and learn more things at the same time. So when Doc was going over the 4th year things, I'm like, wow, I actually know this. There are some things that I didn't remember, but that's why I'm glad that I'm going over it with them, because it's like refreshing my memory, as I said. So I'm gonna go home and I want to make a video on like how to study when you're on this rotation, because I feel like that would be good for people to know. Yeah.
Gonna look.
Alright, let me give it like a story time. So on the last day, which would be today, day 5, I was supposed to cite an access, right? I've been avoiding it for months. Okay, I started doing this type of program in the summer from July, August. Okay, it's October. I have not cited one access. I don't know how I get away with that, but I did, and I was so scared. I sat there with that lady for about 15 minutes before actually putting in a needle. And you know, a lot of people would be like, "No, sir. If you take so long with my hand, I don't want you to me," right? But she was so helpful, and she's like, "It's okay. You got this. You can do this." And I'm like, "Yes, I can do this." But inside, I was crying. Okay. I was so anxious. I was so nervous. Like, people need to. I'm going to talk about that. Anxiety in this field, yo. Like, being an anxious, socially awkward person is not. It's really hard to get through medicine like that, especially in the hospital. So that's what I'm realizing on my own. But I finally got it with the help of the nurse. I tell you, nurses, they are so helpful. Like, they're so helpful. And with Lori and Shamara there, love it. Like, the environment is just so great for me, to be honest. So that's what happened. So that was my week. I really hope it helped, especially for those who don't really know what the process is like. I can't show everything, obviously, for privacy reasons, but what I can talk about, I'll talk about. What I can show or explain, I will. Thanks for watching, and I'm going to be making more vlogs. I'm going to be trying new content, so expect more of that.